Prescription diets for cats with chronic kidney disease. Are they really worth it? Stay tuned because we're going to dive into that one today. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. A common question I get is, are the prescription foods the best food for cats with chronic kidney disease? And unfortunately, there's not a one-size-fits-all answer. I mean, I get it. Of course, you want to know what's the best food for your cat. And when a prescription diet recommendation is made and you don't understand why, or you're not told why, the next reaction is to ask why. And is this really the case? If you dig into what's the best food for a cat question for even a minute on the internet, you're going to find quite the debate. Protein is hard on the kidneys. Cats should eat high protein foods. Phosphorus is bad for the kidneys. Meat contains phosphorus. Cats should only eat canned food because they're constantly dehydrated. Dry food is bad for them. And I could go on and on. I would encourage you to be very, very careful going down the social media rabbit hole when it comes to cat nutrition, or even the internet rabbit hole. A lot of searches are going to turn up some very questionable information and a ton of self-proclaimed experts. Honestly, it's sad, frustrating, and oftentimes infuriating, as nutrition can be such a huge component of the health of our cats. Instead of asking if prescription foods are worth it, I would encourage you instead to assess your cat and where they are in their chronic kidney disease journey. Because the best food is the one that your cat will willingly eat, will maintain their body condition score and their muscle condition score, and hopefully minimizes the needs for medications and supplements. A prescription food is absolutely useless if your cat won't eat it. But if they enjoy it, studies have shown that renal diets, or diets specifically formulated for cats with chronic kidney disease, definitely have benefits. These diets carefully manage ingredients like protein, phosphorus, sodium, and potassium, as well as the acid-base balance, include fatty acids, and a list of other nutrients that really impact the chronic kidney disease body. This helps to keep waste products as low as possible, making the kidney's job easier and your cat feel better in the long run. Let's talk protein. The prescription renal foods have high quality, easy to digest protein. Somewhere along the way, there's this myth out there that the prescription foods have low quality protein or they have low levels of protein. I'm not really sure where that came from, since the only way to really assess that protein is with digestibility studies, which these companies are doing. However, I can address the fact that the low protein is often a misconception, as many of these kidney-friendly diets have protein levels comparable to some of our senior diets. So like I said, it's really a moderate level of protein rather than a high level of protein, and it's easy to digest, which means there aren't a lot of byproducts that should come with it. Now, if your cat has a normal urine protein to creatinine ratio, sometimes this protein level may not be quite as important to your cat. But if your cat is excreting excess protein into their urine, so they have a high urine protein to creatinine ratio, feeding them more protein is only going to increase the workload on the kidneys. And studies have shown that a high protein diet in the face of a high urine protein to creatinine ratio will definitely shorten lifespan. Now, on the flip side of this, we also know that senior cats don't tend to digest and absorb protein as well. So that's where this balancing act comes in. We need to take your cat, their body condition score, their muscle condition score, the lab values we have, the current food they're eating, and compare all of that information to the prescription kidney diets and see, are we going to get benefit by playing with the protein number? This is something hopefully your veterinarian can do for you. If not, a board-certified veterinary nutritionist absolutely can do for you. But we definitely can't run with the theory that cats need a high-protein diet. Some of these cats, a high-protein diet is absolutely going to be detrimental. On the other hand, if your cat has trouble maintaining its muscle condition and they are otherwise stable on their lab work, maybe a little bit more protein isn't the end of the world. It has to be tailored to your cat. Let's talk phosphorus. Phosphorus is probably the one nutrient that just about everybody agrees on, that a high phosphorus load will absolutely worsen kidney disease. And that's because as the kidneys aren't functioning normal, that phosphorus builds up in the bloodstream and causes other secondary effects. However, as I have mentioned in some of my other videos, we have to be careful when we're adjusting phosphorus levels. Prescription diets are generally low in phosphorus levels, but we also have to be careful of what does the calcium to phosphorus ratio look like. Because if our phosphorus is too low, our calcium is going to go too high, and high calcium is no good for the kidneys either. So we have to be cognizant of how much phosphorus is in the food, what does the calcium phosphorus ratio look like, and what is our cat's body doing with that phosphorus? If their phosphorus level is high in their blood, we absolutely need to look at some sort of restriction or some sort of control on that phosphorus. But if their phosphorus is normal, that may not be as high priority at this particular moment in their kidney disease journey. For the cats that won't eat our foods that are low in phosphorus, then sometimes we have to use a phosphate binder so that we can trap all of this stuff in the gut. The body doesn't absorb it, and then that blood value doesn't climb higher. But we need to know, where is your cat in this journey? And we also need to understand that this isn't a static journey. Just because your cat may be at this particular moment in its journey, that doesn't mean that's going to be the same 6 months from now. So, as I said, it needs to be customized. It needs to be customized to your cat, and it needs to be customized to their point in the CKD journey. If you need more information on phosphate binders, check out my other videos for that as well. Other nutrients that are managed in prescription kidney diets are things like sodium, potassium, fatty acid level. These don't get nearly the press as protein and phosphorus do, mainly because we see those as our big players in this disease process, but high sodium levels can definitely be detrimental to the kidneys. Just like in humans, high sodium levels can cause high blood pressure. High blood pressure will definitely injure the kidneys. So if your cat doesn't have high blood pressure, but they're eating a high sodium diet, they're going to be more at risk for developing high blood pressure. If your cat already has high blood pressure, the last thing we want to do is feed it more sodium in its diet and make that blood pressure worse or harder to manage with medications. On the other side, potassium is something that is incredibly important to the body, especially for muscle function. When potassium is low, it's one of the reasons we see weakness in cats. With kidney disease, potassium is oftentimes lost in the urine, so that blood value goes down. When that blood value goes down, what do we need to do? We need to supplement it. Unless, of course, there's enough potassium in the food that's being fed to account for what's being lost. So that's why oftentimes these prescription kidney diets have a higher level of potassium in them than our over-the-counter foods, because we know a lot of cats with chronic kidney disease are losing potassium in their urine, and we need to keep this value higher in the bloodstream. Then there's fatty acids. Fatty acids have so many benefits, but there's definitely differences between omega-3s, omega-6s, EPH, DHA, whether or not we're going for anti-inflammatory effects, what have you. So when I say fatty acids, this is a huge complex category, and honestly, it could probably be a video in and of itself. But suffice it to say that the prescription diets are supplemented in the correct fatty acids to have an anti-inflammatory benefit for the kidneys. We also know that chronic inflammation can damage the kidneys, hence the benefits of fatty acids. Even though some cats would probably argue this point with us, the prescription kidney diets also have enhanced palatability, meaning there have been numerous studies done showing that if we add whatever it is they're adding to the food, cats will like it more. Now, I kind of giggle when I say that because that's usually why we end up in this conversation in the first place, is we're trying to get a picky cat to eat a food that we want it to eat, and they're saying, absolutely not, this is a no-go. And years back, I would say the kidney diets weren't very tasty at all. I don't know that all of them are still very tasty, and no matter what we do, there are going to be cats that don't touch them, but we definitely have more success these days as studies are focusing on that palatability and what cats like and what they are more likely to eat. So many of these prescription foods do have enhanced palatability to try to get them to eat the appropriate nutrients that we want them to eat, but it ultimately comes down to what is your cat's texture and smell preference. And this can go back as far as 6 to 12 weeks of age. I mean, kittens learn what is considered food from their mom. And again, that's usually based on the texture of what it is and the smell of what it is. I've mentioned it before, but there was a really interesting study done where kittens were actually taught to eat bananas by their mom. Now, would we consider bananas a species appropriate food? Probably not, but mom was eating it, so the kittens thought they would eat it too. So, if you have that cat that is not used to eating the textures or the smells that are available in our prescription diets, it's probably going to be an uphill battle to get your cat to eat something that we want it to eat. Not that it can't be done, but it can absolutely be an uphill battle. And that's where things like using appetite stimulants come into play, changing super, super slow over a long period of time, not just a week or two. That's where texture enhancers come in, flavor enhancers come in, things that can change the smell. We really pull out all of the things that we can think of when we're trying to change cats to these foods, because for some of them it's just an uphill battle. And if you are one of the lucky ones who has a cat who eats one of these foods, you may want to find a couple options and actually rotate through them. That's something that can trip people up as well, is that as senior cats age, their taste buds and their salivary glands change, so their taste preferences can change. So sometimes it works best to feed one food for 1 month, a different food another month, and then rotate back and forth or rotate through 3 of them, so that your cat doesn't get the opportunity to get bored, so to speak. Although I use that very hesitantly, because a lot of times what we perceive as boredom is something changing medically and we tend to ignore it then. But no matter what we do, there's always going to be that cat out there that is just not going to eat what we want them to eat, isn't eating enough of what we want them to eat, or even if they are eating a fantastic amount of it, just aren't doing well on it. And that means that food's not appropriate for them. It doesn't matter how good it looks to us on paper or in theory or in the studies. If your cat is not going to eat enough of the food to maintain their body condition score, to maintain their muscle condition score, and do well on it, it's not the best food for your cat. And even if we do have a cat that's eating these well, they still have the risk of developing food aversions. This is that wrench that gets thrown into our plans all too often that will keep you up at night and drive you crazy. And cats are professionals at this. If they are eating a particular food and they suddenly don't feel good, or they are stressed, or something is going on, oftentimes they'll associate all of that with the food, and they will just downright stop eating that food. So this is one of the reasons that if your cat ever is hospitalized for kidney disease, or something major is going on in the home that's stressing your cat out, or they just have a secondary medical problem going on, we'll oftentimes avoid feeding the food that we actually want them to eat, because we don't want them to associate all of the above with the food they're eating. Cats can be so sensitive to this food aversion thing that you really have to keep it top of mind of what is going on. Am I making my cat food adverse, or am I risking my cat becoming food adverse at the benefit of what? So the overarching message here is starvation is never beneficial, and cats are pros at it. If your cat won't eat a prescription food, it is absolutely not the best food for your cat, and we need to come up with different options. Sometimes that looks like doing a nutrition consult with a board-certified veterinary nutritionist. Sometimes that looks like looking at over-the-counter foods and comparing their nutrient analysis with what we're going for and what they're already eating, and picking the less of two evils. Sometimes it just means giving up and saying, you know what? I want you to be happy. I want your body condition score to be great. I want your muscle condition score to be good. Eat what you want, and we're going to try and work around it. These are the pros and cons that you really need to look at when it comes to your cat and their journey with chronic kidney disease. Similarly, when it comes down to the canned food versus dry food debate, you need to feed what your cat is going to eat and do well on. If that's dry food, so be it. We need to find a different way to supplement some of their hydration. If it's canned food, great. Some of those, we still need to add more hydration. It's interesting to me that we focus so much on cats eating canned food versus dry food, when studies have actually shown that oftentimes feeding a canned food only does not change the hydration status of your cat. Now, the caveat to that with chronic kidney disease is we do get to a point where we struggle to get enough water into a cat, so every little bit helps. Please do not misunderstand me in saying that canned food may not be beneficial to dry food. It may be, But there are some people that are so willing to die on this hill that I don't know that it's really worth the argument or the benefit. It goes back to, how is your cat doing? And oftentimes the ultimate answer to that is what, again, their body condition and muscle condition score looks like. What does their weight look like? Are they eating enough calories? What does their blood work look like? And above all else, how are they feeling? Are they feeling good? Because if they're feeling good, then goal has been met. Yes, we want to make the job of the kidneys easy and we want them to last as long as possible, but we don't want our cat to last as long as possible if they just don't feel good. For the cats that will eat them and do well on them, the prescription kidney diets are one of the easiest ways to manage chronic kidney disease. That's not going to be all cats. I absolutely realize that, and I want you to be aware of that. But for the cats that do, it makes it so much easier, and oftentimes we don't need to use medications or supplements until far later in the disease process. For those cats that won't touch these foods, or maybe won't touch the foods we want them, that's where supplements and medications come into play. That's why we have potassium supplements. That's why we have phosphate binders. That's why we have fatty acid supplements. We can add in all of these things. That's why we have the nutritional consults. We can tweak and play and add and do what we need to do, hopefully, to get to where we want to be. But for some cats, the prescription veterinary diets for chronic kidney disease can be an absolute lifesaver, and they can make it so easy. So easy, in fact, that that's usually where cat caretakers are like, wait, this is the only thing I have to do? I must be missing something. Let me grab 10 other supplements. Let me do something else. When in reality, the food's doing the work for you. But again, the cat has to do well, whether it's on the food, off the food with supplements, whatever it is, your cat has to do well. The food discussion really drives home the point that you need a clear, systematic roadmap specific to your cat, their stage in the disease process, and their journey to really know that you are doing what is best for them.